Hello, class. Now we continue with the physical environment and its influence on health. What is the impact of our physical environment or the environment we live in and its impact on our health? It's extremely important that we really understand this piece because most of the time we tend to just focus on some of the things that, yeah, can be contributing, but in reality, they are not as much as we think they are. But when you talk of the physical environment, it's extremely important that we understand that it's that important that we cannot know. We have to know how critical our environment is and its impact on our health and health experience. The last time we talked about, depending on the type of physical environment we exist in, there's the possibility of the type of agriculture that really takes place, wherein enough food is grown to serve the population or its inhabitants, or less food is grown, and that can lead to starvation. And also, at times, some of these things can be influenced by the climatic conditions. Too much rain, hurricanes can lead to flooding, crops being flooded, die, and that can impact the type of or the quality of produce that people experience at the end of the season. Or some people can just live in a desert or face drought, wherein there's no rain. So our physical environment, in addition to some of the other issues, we have to bear in mind that it plays a big role in people's health and their health experiences. Because when you don't have too much food, or when you don't have adequate food, in some cases you starve, especially for children. They don't grow properly. And for adults, older adults, malnourished, and in most cases that can lead to poor health. Quality of water. What type of water do we have or do they have in those environments? If sanitation is not properly maintained, then people drink water that is polluted with microbes that can give rise to dysentery or cholera and some other issues, or can lead to water that is polluted with heavy metals like lead and others. So again, you cannot really emphasize how the environment people live in, also explain the big divide. Those with resources can be able to navigate some of these challenges or completely move away from those challenges. Those with lack of resources, they have little or no choice. And you deal with the housing situation. What sort of housing do people live in? Employment, education, and what sort of health services they receive. Take these three, see how these three are linked. Education, the quality of education, or no education, can greatly determine your income, what sort of job you have, and what sort of insurance you have. That can determine the sort of health services you get. Or the type of job you have can also, or don't have, can lead to your either being employed, what sort of employment, can lead to poverty. So those three, education, income, poverty, they are so linked. They are so linked. We cannot say, okay, those three are the be all and the end all, but to a greater extent, they are just one leads to the other to the other. Education leads to your income level, and your income leads to either you're poor, middle class, or upper class. So now we continue where we stopped the last time. The last time we stopped at housing and health. Housing and health are linked. With your type of housing. Also, as we said, your type of housing exists in an environment. And some of the issues that you experience in housing is overcrowding, where in most cases, you have people who live in multi-generational housing, wherein you have grandfather or great-grandfather, father, mother, wife, grandma, and group in a very small space. When people live in a crowded place, most of the time it contributes to transmission of diseases, easy access to transmission of diseases, and other health stressful conditions. And in most cases, it lives in areas wherein it can be damp and cold. Most of the time, lack of electricity or lack of electricity leads to lack of air conditioning or adequate heating system. Damp, mildew might develop. Certain health conditions, respiratory issues might arise. So the housing, what sort of paint? How old is the house? How strong is the roof? What sort of plumbing system? How effective effective is the plumbing system? How effective is waste masters being treated? Because we should not also ignore some of those challenges. Most of the time, it's poor quality. Air exchange, air flow can contribute. And some people, they lose their job, become homeless, cannot pay rent, homeless. Even right now, there is the debate as to how much can those people who lost their jobs and cannot pay rent. The government is trying as best as possible to help to pay the rent or to help with those people, so that they cannot be evicted from their apartment or from their homes. So these are all challenges that can lead to poor mental health. When you are not sure of your living condition, your employment condition, your food security, because there are a lot of people who also live in food insecure places. They are not secured where they are going to get their next meal. Going with when we spoke about the agriculture, the food production, there are people who some have challenges. They're not sure where their next meal is going to come from. See, when you have to think about where is my next meal, or how secure am I to stay under a roof, a house, than to be kicked out. These are all things that leads to mental health issues. And some people also have mental issues. And they cannot maintain a job. And they have other issues that can lend them to being homeless or face some temporary accommodations. So, how much do we really know about the mental health of our population? Because nobody really wants to be homeless. But at times, mental challenges can contribute. Drug abuse can contribute. And some other stressors, unemployment, and other just lack of effective relationships that are there to help one another, can also contribute to some of these issues. And also the growth of urban slums. People are migrating from rural areas to big cities with the hope of being able to get meaningful employment. But most of the time, when they migrate to these cities, most of the time the cities do not have those housing opportunities. So what happens? they end up developing slums. And those slums are usually, most cases, are filthy, crowded, lack of water, lack of sanitation. All of this lead to problem. Work environment and health. 3 ways in which the work environment can impact on health. Working partners. How much relationship exists? How healthy is the working relationship between your workmates? What sort of respect exists between your workmates? It's very, very important. Is your work environment hostile? Or, because these are all things that can play. Or, again, the working pattern. You have this, your schedule is so erratic. Today you work from 1 to this. The next day you work from 4 to this. The next day, creating it wherein your body cannot adjust to your work pattern. See, when people have, our body can adjust effectively if there is a pattern. Because most of the time when some people are sleeping, you have some people who are at work. And their physical and mental body is adjusting to those patterns. So when we are at work, they are sleeping. You see, because all of those things affect our health. When people have a regular work pattern, it's okay. But when that pattern is erratic, the schedule is everywhere, all over the map, it really does not help. And who are the people that are most subjected to those kind of work patterns? Most of the cases are minorities. Most of the cases are people with less education. Then the physical environment. Is that environment safety? Is it a safe work environment? The ventilation proper? Less for accident, less room for accident. Because going back to number and say the work pattern, most of the time when that becomes the situation, when your work environment is sure that your schedule is so erratic, it gives rise to mistakes, possibilities for accidents, because your body cannot adjust effectively to the routine. Then you have the psychosocial harassment issues, disrespect, people treated better than others, people look down on others. Again, those are things that do not help with people's health. And most of the time, It's becoming a challenge, wherein every now and then, how safe is the work environment? Every now and then you hear shootings in workplaces. How safe is the work environment? Because the healthier the community, the healthier the work environment. But when the community is not healthy, people are emotionally unhealthy, the work environment becomes a place wherein they can focus their frustration. So all of these things, the three, the work patterns, the physical working environment, and the psychosocial impact. These are all very, very important factors that needs to be addressed in dealing with the work environment and health. Okay, working patterns, irregular shift patterns are detrimental to health. As I said, the physical and mental. Why? Disruption to sleep patterns, patterns of unhealthy behavior associated with working shift stress. So it's very, very, very important. You have to have a regular shift. The physical working environment. You have the sick syndrome, symptoms caused by conditions of the building that people worked in. Impact on health, reduced productivity, and increases absenteeism. The Whitehall studies shows low level of work demand, control and support associated with higher rate of absence. Impact of temporary and permanent employment. Latter is better for health. See, when people are permanently employed, it's much better for health than this temporary, because people will be thinking, how long is this going to be? Or if they know after 6 months, what am I going to do? So even to plan for their life, plan for their family becomes a challenge. But when they have a full-time employment, they can plan better. Employment and health. Being employed is detrimental to health. Causal link between employment and adverse health outcomes. Many factors might contribute to this. Maybe lack of quality and poor education. And at times, race, skill levels, lack of skills that the workforce needs. And at times, people's attitude can also contribute. Now, people who are unemployed experience higher death rate than people who are employed. See, when you are employed, you are able to, everything being normal, depending on the type of employment, You are able to have a roof over your head. You are able to take care of your family. Depending on the type of job, also, you are able to seek the appropriate medical service and provide adequate food for your family. When you are employed, those things are not they are not, it varies. But in some cases, you are out of reach of some of those things. Unemployment causes increased financial pressure and increases individual vulnerability to other life events. Most of the time, increased pressure and increased vulnerability to other life events, such as life of crime, education, and health. There is a positive association between education and health. Education leads to better health experience. Good education leads to better health experience because when you are educated, most of the time you can also be health literate. You can explore, find out certain things on your own. You are empowered to seek help when you need it. You are likely to engage in primary and secondary prevention on a timely basis. And yes, depending on the type of education that you have, you also have a good health insurance that can encourage you to make sure that you take advantage of the primary healthcare system so that you prevent, you don't wait until it's too late for disease to express itself in your body that it will eventually be difficult to heal. That's why in most cases, the outcome when it comes to the outcome of cancers in various minority populations. Some of the factors is also the level of education. Even though education by itself is not a be all, there are other factors that education could be a factor, but there are other factors that contribute to the prevalence of cancers among minorities. Ross and Wu offer three explanations for this. Education provides you work and creates an economic conditions. When you are meaningfully employed, you have a meaningful income. With a meaningful income, you can take care of yourself as well as your family, and you can live in a safe environment. And also, it will improve your social, psychological resources. And everything being normal, it can also improve your lifestyle. Because some of this lifestyle that people in poor people engage in most of the time is because of lack of education for some, lack of an employment, and therefore The human being does not say, okay, because I don't have this. They always want something. They can get some of those things the right way or the wrong way. And some people will engage in some ways that are very risky and can lead to sudden death. And at times also can either in terms of food, engage in eating food that are very unhealthy, drink that are unhealthy, alcohol and other, smoking, engage also in a life of crime. Dealing with drugs or prostitution. The more educated you are, the more likely you are to work full time in fulfilling subjective. The more educated you are, the more likely you are to work full time in fulfilling subjectively rewarding work, report a sense of control over your life and your health, and greater level of social support, reject health damaging practices such as smoking and taking up health enhancing practices. So let me go about this one more time because it's so important. The more educated you are, the more likely you are to work full time. And that will help. You will experience a reward because there's benefit that comes with full-time employment. Regular income coming in and health insurance benefits, contribution to your social security income. So all of these things are just rewarding. That will give you a sense of control. You can control your life. You can control the life of your family. You can provide support for your family. And you also have a much greater support. And with the level of education, you can reject the practice of poor health behaviors, such as smoking. And most of the time, you can also engage in exercise, regular exercise that can also improve your health. Healthcare services and health. The availability and accessibility of healthcare has a huge impact on health. The availability and accessibility. First of all, it has to be available. So even right now, at once there was now it has become much, much better. But some months ago, the vaccine was not available in some communities. And therefore, people did not have access to that healthcare service. So it was difficult for them to take the COVID vaccination. Now it's much more available and much more accessible for people to engage in some of those. And you go back to when we were talking about infant health. For example, maternal and infant health vary considerably to the income of a country. See, the healthcare service very, very important for maternal and infant health. Because in most cases, in fact, they said you can know the quality of a country the way they take care of their young and their old, the infants. But you cannot take care of the infant and ignore the mother. So you take care of the mother. When the mother is healthy, just has the right resources and the right opportunities, the right care, increases the chances for her to be able to have a healthy infant. And a healthy infant can grow to a healthy child. But some of this varies, in countries. Here it varies by groups, ethnic groups, racial groups. The physical environment, our living and working conditions, has a large part to play in our experiences of health, according to Donaldson and Scully. There are many other factors of our living and working conditions which impact on health. Different environmental factors may interact with each other to influence health. Additional factors, natural and man-made disasters, hurricanes, tornadoes, floods, guns, mass shooting, attitudes that have developed against one group and against the other. Those are man-made that impact health. Climate change. Now you say when it dries, it dries. When it's hot, it's really hot. When it's cold, it goes really, really cold, as it was experienced in Texas, wherein they've never experienced that level of cold, almost brought the whole state down. And at times when the hurricane season comes, we have so many of them. So which is a big challenge for those people living in the coast. Because when it comes, it destroys homes, displaces people, and from somebody that once has a house before the hurricane, after the hurricane, become homeless. Outdoor air pollution. people with allergies, manufacturing plants. What air do they release? These are all things that are a challenge. Solid waste disposals. Again, that's a big challenge. We consume and we throw away so many things are thrown away, and they become easy places for infections to develop. So they do not only destroy human lifestyle, but also destroy the quality of fish, because most of the time people like throwing things in the sea, in the rivers. And when the fish or sea product that we eat is contaminated, it end up affecting people's health. Transportation, overcrowded streets. As populations grow, you have more people with cars, more hydrocarbon being released, used to drive those cars, more the green gas effect. And it is important to consider factors within physical environment and how this can influence health and health experiences. Identifying environmental factors affecting health can help to address them and potentially make a real difference to health outcomes. This can also influence health policies, how physical decisions are made, and resource allocations to improve health. There are many aspects of physical environment which impact on health and health experiences throughout our living and working conditions. Research into these factors and the impact of them is challenging, because whilst positive relationship and associations can be demonstrated, causal mechanisms can be harder to determine. But at times, most of the time it's always better to let's work with what we know, because trying to find how and why or who is to blame, most of the time it's a sure way of reaching a dead end. Let's start with the little steps by just identifying those real connections, how the physical environment affects health. Let's work on those, then we continue to expand. One thing about knowledge, we have come this far simply because there were people who were ready to take the very little information they had, work on them, and from there it started expanding. And today we have so much information on things. I think our biggest challenge these days is people's attitude towards solving some of these problems. See, some people have negative attitudes trying to solve some of these problems. And some people have I don't care kind of, it doesn't affect me, it's not my business. And you have some people that are really, really committed to solving some of these problems. But again, if these problems are not solved, even those who think they are okay with it, they'll be surprised when they become victims of these situations. The relationship between our living and working conditions and the way that we live our lives is very complex and involves the interaction of a large number of different factors, which are hard to separate from each other. Human being is complex. It's a web. There are a lot of interconnectivity of certain things, one leading to this, one leading to this. At times, it's a web. And one thing that we can do is try to, wherever you can cut that link, cut it so that it does not lead to other. And most of these things cannot be addressed with one shot. It takes time, it takes education, it takes creating opportunities for all, reduce the level of poverty, making living conditions appropriate or good for all, and reduce those man-made factors that contribute to human health or poor health. Okay.